Good afternoon. We have with us Dr. Saurabh Kundu from the School of Tropical Medicine in the Critical Care and Infectious Disease, Kolkata. We welcome you to the Natco Pharma Specialty Criticon 2024 studio. We look forward to hearing from you and advice to the young generation of doctors in the space of critical care associated with antibacterial resistance. Our very first question is, how do you foresee the changes in critical care management?
The antibacterial resistance day by day increasing very much. We are dealing with multiple antibacterial resistance in ICU. There is a pattern of resistance is increasing like NDM, like oxafortin resistant, like carbapenem is resistant enterobacteriaceae, and also multiple resistance organisms like Acinetobacter baumannii. So each organism has a specific resistance pattern. We can choose the antibiotic according to their resistance.
Uh, with regards to the younger generation of doctors, the ICU doctors, what would you tell them to enhance patient care?
Oh, I should tell my junior doctors to use less use of antibiotics as much as you possible. Do not treat the reports. Treat the patients with symptoms. Do not as much you as less uh, use the antibiotics. Uh, Always treat the patient because the resistance pattern is such a just increasing in number. So we have so limitation of antibiotics, rest amount of sin that only the polymyxin, only the tigecycline, minocycline, and ceftazidime. That's the last option we have. There is no upperwards. Sometimes we are getting all resistance to this, also these drugs. So what's next? So we should use minimal use of antibiotics. So the resistant pattern becomes calmed down.
What is the prevalence of carbapenems producing bacteria in your practice and the best treatment options that you could think of?
Yeah. Uh, we when we treat a patient with ICU, the more than 50% patients we are getting from the culture, either urine culture or sputum culture. If the patient is on a ventilator, when we can get the ET tube CS, it's 90% carbapenems resistance active bacteriaceae. And when is the see the gene pattern, if the multiple times is oxafortin, multiple times is NDM, and according to this we have select the antibiotic either ceftazidime avibactam, either if the MIC value is less than 16, we can use the high dose meropenems or any carbapenems along with tigecycline or minocycline.
Great. Dr. Kundu, we thank you so much for your time. We wish you all the best in your School of Tropical Medicine, and we once again value your insights that you shared with us.